Hi there, my name is Nasia and I am a midwife and wanted to do this video on pregnancy loss to help those that would like some information. And this is not a complete information. There's plenty of resources I will list at the end or in the bottom that you can access of this video, so please do that. When you realize you're pregnant, your mind goes in 1,000 directions. You both want to buy a car seat and you're also terrified, maybe, am I not ready for this? And then you experience loss, and that can be heartbreaking. I speak to you not as someone who just pretends to know. I've personally experienced a loss as well, and have to grieve. Between my first and my second baby, I had a miscarriage. So I get it. So what am I talking about? Pregnancy loss, miscarriage. It's defined by the Women and Newborn Health Service as a loss of a fetus or a loss of a pregnancy under 20 weeks. There's two kinds. There's an early loss under 12 weeks and a late between 13 and 20. About 20% of women experience a miscarriage, and the numbers actually could be greater because some women don't even know that they're pregnant and they just think that they've missed a period or they're having a late heavy loss. And actually it was a pregnancy or a loss of a pregnancy, really. I'm going to go into a few different areas. So we're going to list some higher risk, some things that put you at higher risk of having a miscarriage, symptoms, some types of miscarriages, management, aftercare, and some resources. Please also know that we may never understand or know the true cause of our miscarriage, and that's really hard for us to understand or accept. But it is, it just is the normal, and that's okay. It doesn't mean we can't grieve. It doesn't mean we can't process. It just means sometimes we have to accept the unknown. So what puts us at higher risk? If you're over 35, if you have chronic or long-term health concerns, if you have uterine or cervical abnormalities, if you smoke, if you drink alcohol, if you have caffeine, if you take illicit drugs, if you weigh, if you've got a high BMI or you're very underweight, and if there's a genetic condition as well. So if you want to get pregnant and you have concerns, please talk to a health professional and who can put you on the right track, who can address your concerns and be able to direct you accordingly. Some of the symptoms. So symptoms of a miscarriage, signs and symptoms, vaginal loss, pain and cramping, fluid or tissue passing from the vagina, and a smell. So just know that if there is a heavy loss, a blood loss, if there is a substance that maybe is not normal for you to come out of your vagina, it could be some tissue that was part of the pregnancy. And so all of those are signs and symptoms that a miscarriage is happening, has happened, and you can contact your healthcare professional, your healthcare. You can doctor if you've got one, a GP, or you can go straight to the ED if you're concerned at all. So there's different types. There's complete, so all of the products of pregnancy, baby, and the tissue come out. You can save it. It can get tested. Some don't even know that it's come and it's been flushed down the toilet, and that's absolutely fine. It does happen. It can be a missed miscarriage. So this occurs when you believe you're pregnant and then there's no signs or symptoms of the miscarriage, but actually there was no growth in that pregnancy. And so that you go get an ultrasound, and that does happen, unfortunately. There's also an incomplete, so some products of pregnancy come away, and we could talk about the management of that. There's also a molar miscarriage, so it's not a true pregnancy. There was never a developing fetus. It's also an ectopic pregnancy, so it's outside, it starts growing outside of the womb, which is obviously not viable. So then there's management. There's natural management, so it's just the body's way of letting go of the pregnancy and letting go of what was occurring, and it comes away by itself, and bleeding could last up to 2 weeks. There's medical, so medication is given to complete the miscarriage. It could be pain and heavy bleeding for up to 14 days. The medication is misoprostol, or can be misoprostol, and it's either given into the vagina or buccally into the gums. And what it does is it basically assists to dilate that cervix so that the products of pregnancy can come out, or the neck of the womb really, and it opens it up and just allows everything to come away. And then there's surgical, so dilatation and surcharge, or D&C. So basically it's light bleeding and pain. It's a medical procedure. You'd go to a hospital, surgical procedure, you'd go to a hospital, they would surgically remove the products of pregnancy. And your obstetrician, your doctor will explain if that is what is required. They'll explain that whole process to you. If I want you to also know, please call 000 or go straight to the ED. If you soak a pad at any time in this, soak 1 or 2 pads in an hour. If you have large clots the size of golf balls, if you have severe abdo pain, fever, chills, dizziness, fainting, signs of infection, smell, or color in the discharge, none of those we want you just to sit at home with. Please go and access care immediately. So after you have experienced the miscarriage, whether it's by natural, medical, or surgical means, please wear pads and not tampons. Please consider pain relief, so Panadol, ibuprofen. If you have any allergies, please don't take those medications. Go speak to again a healthcare professional before you start taking a medication if you're uncertain. Rest. You need plenty of rest. You need rest for your mind. You need rest for your body. You need rest for your soul. You need to heal. You need to access support. It could be friends and family if they know, but if they didn't know that you were pregnant, maybe you need to talk to somebody else. And I'm going to give a list of helplines and other people that are skilled and good and want to help you through this journey. You're not alone. Please remember that. Avoid sex for 2 to 6 weeks. Talk to the doctors, talk to obstetricians, to know exactly this is not because there's something wrong with you. This is just to help you heal, and also to ensure that your body gets strong before you try and get pregnant again. We'll also avoid swimming while you're bleeding, just to avoid any infection from coming. So there's different resources. There's SANS and Red Nose. They're for both partners in the loss. Please, we do this together. There's Pink Elephants. There's Bears of Hope. It's free counseling. There's Panda. There's Men's Line and Beards of Hope for men who go through this loss in a very different way. And it's important to acknowledge both parties in this loss. There's also information on Miscarriage Australia. There's fact sheets on there that are so helpful. The King Edward Memorial Hospital also has a document on loss. St. John of God Hospital also has a document on their website for living with pregnancy loss. There's a book by Kate White, Your Guide to Miscarriage and Pregnancy Loss, Hope and Healing When You're No Longer Expecting. Please remember this loss is a journey. Acknowledge the loss. Acknowledge the stages of grieving, denial, anger, bargaining, depression, and acceptance. All are important. Talk, get help, be seen, and this is not the end. Hope for the future. Hope for the next pregnancy. You're not alone. I hope this helped. Please look down at the bottom for any of the resources that I've mentioned. Thank you.